Hi everyone, today we will read the news. Tocilizumab shortage continues as pandemic wears on. With worldwide supplies of tocilizumab dwindling as the COVID-19 pandemic rages on, the shortage of the agent will persist for at least the next several weeks, according to Genentech. The Roche unit that manufactures tocilizumab under the trade name Actemra for the World Health Organization and United have called on Genentech to guarantee equitable distribution of the biologic agent globally and to ease up on technology transfer restrictions to make the treatment more accessible. At this point, supplies of tocilizumab for subcutaneous use to treat rheumatoid arthritis and its other approved indications for inflammatory conditions aren't as dire, but Genentech is waiting them as well, the company says. In June, the U.S. Food and Drug Administration issued an emergency use authorization for intravenous tocilizumab for hospitalized COVID-19 patients. Since then, it has been included in the WHO Therapeutics and COVID-19 Living Guideline. And on the same day, Genentech and Roche reported the tocilizumab shortage. The European Medicines Agency reported a statement that it had started evaluating raw Actemra, the European brand name for tocilizumab for hospitalized COVID-19 patients. The FDA authorization has caused an unprecedented run on supplies for the biologic agent, which is FDA approved to treat RA, giant cell arteritis, systemic sclerosis associated interstitial lung disease, polyarticular juvenile idiopathic arthritis, systemic juvenile idiopathic arthritis, and cytokine release syndrome. Depleted stocks. In the United States, stock of the 200 and 400 milligram units were unavailable, according to an FDA update this week on its website assetdata.fda.gov. And the 80 milligram for for millimeter milliliter unit is available by dropship only. Supplies of 80 milligram units were unexpected and it were expected to be depleted by the end of this week, Genentech said in a press release. The company expected to resupply stocks by the end of August. However, the Genentech state added, if the pandemic continues to spread at its current pace, we anticipate additional periods of stockout in the weeks and the months ahead. For patients with RA or other approved indications, taking the subcutaneous formulation, pens, and prefilled syringes. Supplies continue to be available, but the company added the supply situation continues to evolve. The subcutaneous formulations aren't authorized for use in COVID-19 patients. However, the American Society of Health System Pharmacists website lists of the 162 mg for each 0.9 milliliter prefilled syringe as one of the products affected by the shortage. In a separate statement, Roche said that demand for tocilizumab increased 300% in developing countries over pre-pandemic orders, and the U.S. demand spiked more than 400% in the first 2 weeks of August. Roche laid out 4 reasons for the shortage: global manufacturing capacity limits, raw material shortage, the overall complex process of manufacturing biologic agents, and the dynamically evolving nature of the pandemic. The Roche statement notes the company ramped up manufacturing of tocilizumab more than 100% over pre-pandemic capacity. With regard to either WHO and United States in their statement, Roche said that about 60% of its COVID-19 supplies had gone to developing countries, and that Roche and partner Chogai, both of whom hold tocilizumab-related patients, won't accept any patient over its use for COVID-19 in low and middle-income countries during the pandemic. Roche is in the midst of discussion with WHO, and we are committed to support access in low and middle income countries as much as we can. As Roche spokesperson told Mascate Medical News, Blaine Slow, MD, chair of the American College of Rheumatology's Government Affairs Committee, says the organization supports the equitable distribution of tocilizumab. We will work for ensure that our patients continue to have access to the medications they need. She said, we will continue to engage with the FDA and others to address shortages and ensure patient access to critical therapies. Thanks for listening, and I will send the vocabulary later.